Merci de vous joindre aujourd'hui. We will begin with short presentations from our speakers, followed by a Q&A session with councillors, MPPs, and MPs, and media if there is time remaining. Before we begin, I'd like to go over a few items. We will begin with a reminder to please place your microphone on mute until I invite you to speak or to ask your question. The view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de l'écran. Je passe maintenant la parole au maire Watson. Please go ahead, Mayor Watson.
Well, thank you very much, Jessica, and good afternoon, ladies and gentlemen. Special welcome to our colleagues from the federal government and the provincial government. I want to thank local MPs and MPPs for their tremendous cooperation over the course of the last several months as we've dealt with COVID-19. Je veux dire merci beaucoup à les députés provinciaux et fédéraux pour votre appui. C'est bien important pour nous autres de travailler ensemble, les trois paliers du gouvernement. And we very much appreciate the ongoing support, both financial and other support that you've given us during this very challenging time. I'm sure you agree with me that the recent increase in COVID-19 cases in our city is a serious concern. Seeing the long lines at the local testing centers has been frustrating for many of us, myself included. And we understand that this can be very discouraging, particularly if you're bringing children when you get tested. I've spoken with the presidents of the Ottawa Hospital, the MOFOR, and CHIO, and made it clear that this situation must be resolved as quickly as possible, especially when we head into cooler weather. The City of Ottawa is committed to working with the Champlain COVID-19 Response Committee, the Ottawa Hospital, CHIO, Queensway Carleton Hospital, MOFOR, Ottawa Public Health, and other health partners to lower the wait times at their testing centers. Over the last few days, I've had several conversations with Cameron Love, President and CEO of the Ottawa Hospital, and Cameron has committed to increasing the hours of operations. I'm very pleased to announce that starting today, this afternoon, as a matter of fact, the Brewer Testing Center will be open from 7:30 a.m. to 9 p.m. An additional 4 hours has been added on that will help to a large degree. We're also looking at an online booking system through the hospitals that will also help make sure that people arrive and don't have to wait 5 or 6 hours to come at their pre-scheduled time. And we'll have that up and running, I'm told, in the next several days. And that will also speed up some of the administrative work if it's done online before you arrive on the site. Dr. Leduc, le président qui est responsable pour l'hôpital Montfort, is actively working with city staff to identify a site in the East End. We hope to have an update on that very, very shortly. So this continues to be a priority, I know, for East End councillors, Councillors Tierney and Luloff and Dudas, as well as certainly councillors or MP Mona Fortier, as well as the provincial member of parliament, Stephen Blais, and of course, Lucille Collard and Marie-France Lalonde. So we've heard you loud and clear, and we're working very hard to get that location firmed up. We're down to a short list of, I think, 2 or 3. We hope to have some good news on that very shortly. The testing centers at Moody and Heron are actively working on doubling their capacity from 500 tests per day to 1,000. Of course, keeping testing centers open longer and opening additional testing sites means hiring more staff, which no question is a challenge. Some of you may have heard of Dr. Forster's call to action at Ottawa Public Health's media availability session yesterday for retired nurses and healthcare professionals. I want to thank those of you who decide to return to work. Thank you for making this sacrifice to help protect our community. I also want to thank our incredible healthcare workers, in particular nurses and doctors who have been working tirelessly long hours throughout the house parties that are the source of many of the causes we have seen recently. And of course, you cannot do proper tracing or tracking if you don't know the people in the parties that you perhaps are hosting. These proposed reductions would not apply to commercial spaces like restaurants and retail spaces, which by and large have been doing a very good job of following public health guidelines. And we don't want to find ourselves in a situation where we close a restaurant, which has regulations and protocols to follow, only to see those people go and start showing up at house parties or cake parties and the like. The bylaw services and OPS are also stepping up enforcement. If you're working in a public setting, for instance, at a restaurant or a store, where a mask is required and you're not following public health guidelines, you risk getting a severe fine. So the days and hours of warnings and education have come to an end, and now we're going to start ticketing. Yesterday, I spoke to His Worship Maxime Pedneau-Jobin, Mayor of Gatineau, about aligning Gatineau's rules around gathering limits to the same as Ottawa's. Just to be clear on this, right now, the public gathering maximum in Ontario is 100, and the public gathering in Quebec is 250. So I heard today, for instance, when I met with the Ottawa Hotel Association, that a hotel had booked this banquet. They wanted more people to come. We couldn't allow that under Ontario guidelines, so they've gone and rented a facility in Gatineau. But we don't want COVID going to Gatineau, and we don't want people from Gatineau coming in and bringing COVID to our part of the province as well. So I thank Maxime Pedneau-Jobin for his collaboration on this issue. We need to get the Quebec government to bring that 250 down to 100 so that we're consistent on both sides of the river. Of course, I also want to remind residents that we must remain vigilant. As we have seen, COVID-19 is still very much in our community. We need to follow the guidelines for social gatherings outlined by the province. And we need to ensure that we remain COVID-wise, wear a mask where required, isolate yourself if you're feeling sick, stay 2 meters apart from those outside of your household, and exercise proper hygiene, hand hygiene. Let's continue to work to help protect the health of all residents. And finally, with respect to going back to the testing centers, we're also actively working, and we're very close through the hospital network, which is responsible, as you know, for the testing of locating a site within the central core of the city so that it's more convenient for people in the downtown areas and the wards in the downtown to get tested. We also have to continue to ensure that we have capacity at the laboratories, because obviously we can test as much as we want, but if the results aren't coming back in a reasonable time, that makes those tests somewhat a challenge. So I want to again thank my colleagues. Je veux dire merci beaucoup à tous les élus qui travaillent très fort avec les experts de santé, Dr. Etches et ton équipe, and to thank the hospitals that are under tremendous pressure to not only provide a good level of service at the testing centers, but also now that surgeries are coming back on stream, they're having to rearrange nurses and specialists to get back in the operating room. So I recognize it's a challenge. I have another meeting with respect to COVID that I'm going to have to get to, so I'm going to have to bid adieu, but leave you in good hands with my colleague Keith Eglai, who is the chair of Ottawa Public Health and who continues to do a great job in that portfolio. And as I said in French to my colleagues, both provincial, federal, and municipal, we thank you very, very much for your positive contributions. We will get through this challenge together, and I'll hand it back to our moderator. Merci encore. Thank you.
Merci, Monsieur le Maire. We will now hear from the Chair of the Board of Health, Councillor Keith Eglai. Please go ahead, Chair.
Good afternoon. Bonjour, Quay. I want to thank all my colleagues for coming out this afternoon, as well as the elected officials from various levels of government for the Ottawa area. I just want to start by saying we heard loud and clear at Public Health from you that you wanted a forum where you could bring your concerns directly to those who are organizing and running the testing sites. So I want to thank the panelists I'm going to introduce shortly for making themselves available. So you have this opportunity, this focused opportunity to speak just to that issue, ask the questions that you need to ask, get the information that you need to have for your constituents. And what we would ask of you, of course, is to share that information as widely as you can, as well as what the mayor indicated, that we have to get back to those basics and stick to the washing of hands, wearing of masks, physical distancing, don't go to work when you're not feeling well, all those things. Those are basic, simple actions that we can all do and that we need to reinforce with our communities. So as you can imagine, Ottawa Public Health and its partners have received many questions over the past few months related to COVID-19 testing in the region. This technical briefing has been organized in an effort to provide answers and additional context, specifically regarding testing. As I said, this is to be a focus session just on the issue of testing. Today, we have representatives from organizations who are involved in the testing strategy. We have Ottawa Public Health's Deputy Medical Officer of Health, Dr. Brent Malogny, will provide some remarks as to OPH's role and the use of testing in our overall COVID-19 response. From the Champlain COVID COVID-19 Response Committee, or as we call it, CRIC. We are joined by Dr. Alan Forster, the testing strategy lead, and we're also fortunate to be joined by Nani Kuche, Executive Director of the Somerset West Community Health Center. Following remarks from our speakers, we will then open the floor to questions from councillors and other local elected officials. Time permitting, we will open the floor to the media as well. We have a limited amount of time booked, however, and should the media not have the opportunity to ask their questions this afternoon during the session, we'd ask that you please reach out to ophmedia@ottawa.ca, and we'll make sure that the information that you need to answer the questions is provided to you in a timely fashion. Again, I want to thank all the panelists for coming out this afternoon, making themselves available, because as I say, I know there are a lot of questions about who's responsible for organizing testing, what the issues are to providing more service, more opportunity for people to get tested, all of those things. So I'm going to turn it over to Dr. Malagny, who will lead off with his presentation with regard to OPH's role, and that will be followed by the other presenters as to how they fit into the puzzle of testing for COVID in our city.
Great. Thank you very much, Chair. And good afternoon to all. Bonjour. I would certainly like to thank all of my co-presenters, as well as all of you for giving me the opportunity to speak with you on this important issue. In my remarks, I'm going to focus on aspects of the test itself, and I will let Dr. Forster address the operational aspects of the testing center. I mean, for Ottawa Public Health, I mean, certainly we're very interested, obviously, in people who test positive. All those cases are reported to us, and they're close contacts, so that we can do all we can to prevent further transmission. The PCR test, or the test that is done in the testing centers, is a diagnostic test, and ideally it would answer our question that's on all of our minds as to, well, is this person infectious or is this person not infectious? And I guess what I would say to you all is that the test doesn't really always do this. Its best use is if someone has symptoms or they're a recent high-risk contact of a known case, and if they test positive, then it means that they're likely infectious. When we test people who are asymptomatic, they don't have symptoms, or they're not a high-risk contact, the negative test actually can be falsely reassuring. And in subsequent slides, I'm going to go into a little bit more detail for you with that to explain that. And also a positive test may mean that they in fact are infectious, but it also may mean that they had an infection weeks ago and they are no longer infectious, because people can have parts of the virus, they can have inactivated virus that continues to be shed for some weeks, even up to 90 days. And so while they'll still test positive, they are well past their period of infectivity. And then the other issue, or the other possibility, is particularly when we're testing in populations where there is not a lot of disease. And by a lot of disease, I would use examples of other cities in the world that have had, fairly massive infections where, 15–20% of the people are infected at any one time. So New York would have had that situation. Italy in the early spring would have had that. Then that's high. But in our case, where, even up to the summer, we might have had 1% of our population who had ever been infected, let alone at any one time, the infection amount is much less. And therefore, we are in a position where a positive test could actually be a false positive. If I could have the next slide, please. Now, so here's a pictorial example of our ideal testing situation where, someone has become infected. On average, it's about 5 days afterwards when people develop symptoms. They recognize they have symptoms. They go for testing. A positive result is found, and from the moment, ideally and hopefully, that they started to first develop symptoms until 14 days after symptom development, they are self-isolating and not exposing others. And in this case, as I indicated, we have confidence in what that test result means in terms of being positive. Similarly, the person who tests negative, person with symptoms who tests negative, we can say, listen, it doesn't seem to be COVID. You should still stay home until your symptoms are clear for 24 hours, but we don't think you have COVID. Now, if that person's symptoms continue to worsen over the period of time, then usually in that situation, we would say, you probably want to get tested again. Maybe it was just a little too early to be tested, and we should make sure that you're tested a second time. And certainly we've had instances where in that type of scenario, someone has tested positive on the second test. Again, that is when someone tested negative initially with symptoms, but their symptoms continue to worsen. If I could have the next slide, please. So this is the situation where a lot of people, and I think where a major source of misunderstanding is people seeking testing for what they'll refer to as peace of mind. And what I would say, and I hope you'll understand by the time I'm finished, that in fact, it's less peace of mind and actually more falsely reassuring. Usually the scenario is people have something coming up, they're going to visit someone, maybe their child's going to school, maybe the workplace is saying, we just want you tested before you show up. Or I've seen, you're going to switch teams and we'd like to have you tested before you come. And the idea is, well, we'll have a test some days before that so that we'll be reassured. And so there's a couple of problems with this. So first off is, for a period of time before the person is tested, they could be infected, but the test isn't positive yet. It takes a period of days for the virus to grow inside the person after they're infected until there's enough virus detectable in the back of their throat for the test to be positive. So they basically have been tested, they tested too early, and there's going to be a gap of a period of days where they'll be falsely negative due to low levels of the virus. And of course, after they have the test, for any time after that, if they become exposed and infected after that, of course, the test would not be able to pick that up. And so what one has at the end of the time period where you're saying, I'm okay to go to this get together or do this visit or go to a gathering, is even though you had a negative test some days ahead of time, there's several days in which you could have become infected just before you did the test or after the test. And in fact, you could be infectious while you're going to that get together. And so really, if one is truly seeking peace of mind, it is actually to be COVID wise to reduce your risk of being exposed in the first place. This is, when I explain this to some people, they're surprised. And sometimes I use the analogy of a test that people will have perhaps more familiarity with, which has many of the same characteristics, which is a pregnancy test. If you think of a woman who's sexually active and not using birth control and has a pregnancy test and it's negative, we know that it would be not terribly reassuring to know for sure they're not pregnant, because they could have become pregnant in the days before they did the test, and it's just not enough time has gone by for the test to become positive. And similarly, after the test, they could have become pregnant afterwards as well. So it's not a completely unique issue with this COVID test. It has similarities with other tests, but the potential to be falsely reassuring due to the potential to not having had enough time from the time of exposure prior to the test, as well as what may have happened afterwards. And so it's just better to be COVID wise. If I can, next slide, please. So just to illustrate some of these scenarios, and so this is all in terms of trying to illustrate the limitations of asymptomatic testing. So in the first one at the top of the page, where someone is tested, their negative results are coming back, but in the interim period from time of being tested to the time they're going to want to act on these results, that they have become exposed and become infected, and then they show up at that social gathering reassured, but in fact they're infectious. The next scenario is that the infection happened within a few days of prior to the test occurring, So the test will not pick up the virus yet because there's not enough has grown yet in the back of the person's throat. The test comes back negative. They're reassured, but they're falsely reassured because they're on their way to becoming infectious, and again will be infectious when they go to that social gathering. And then one of the downsides, as I indicated, where people with remote infections, the 2 weeks have passed, they're no longer infectious, they're getting tested for whatever reason, and they test positive because people continue to shed non-infectious particles for a period of many weeks, sometimes even months, and they come back positive. And in public health, we're going to have to treat that positive seriously, and we can't tell that this is a remote infection. And so that person and all of their close contacts, including all of their household contacts, are going to be in isolation for 14 days. And so that's going to have, implications for them, socially, economically, for their going to work, going to school, etc. And there's no public health benefit because they're not actually infectious. If I can have the next slide, please. So what I've been talking about is in terms of the impact of testing and trying to interpret results for individuals, but there's also system impacts of testing and testing in individuals where there is quite limited benefit in terms of what the information will provide. And the first off is that we will always have finite testing capacity. I mean, we've already heard the mayor, and we're going to hear Dr. Forster shortly around expanding the capacity, but it will always be finite. The reality is if we wanted or hoped to have testing to be our primary control mechanism, the modeling has shown pretty clearly that we would have to be testing every single person every 3 to 5 days. So for Ottawa, if that's basically 300,000 people would need to be being tested every day. Clearly that is far away. I'm not sure we would ever actually achieve that, frankly, nor has anyone in the world achieved that. Testing is a contribution to the control of COVID. But at the moment, with finite testing capacity, and that's both the people who are doing the swabs and the lab to be able to actually run the results and get them back to us in a timely way. The risk for us all is that people who are less likely to have infection have the potential to be diverting capacity away from those that really, really need to be tested and are a priority to be tested. And just to repeat, those are people with symptoms or who are a close contact of a confirmed case of COVID. Now, with schools reopening, plus also experiencing increases number of cases in our community, really our focus on testing really needs to be on those with symptoms and the high-risk contacts. If I could have the next slide, please. Now, I just want to touch on this because I want to share this experience with you because back in the sort of early summer, as we began to see neighborhoods with more cases than some other neighborhoods, we were thinking that testing access might be an issue, and so we did some neighborhood pop-up type testing centers. And it was a bit of a surprise for us was that we actually did not find very much COVID. The percentage or the proportion of people who tested positive was actually quite low, and actually much lower than what we see at the actual assessment centers. And I mean, we did some conversations with the communities to try and better understand, and I think we're going to hear more from one of the other speakers to expand on some of these concepts that there are COVID access is more than just access to a test. There are social conditions, both related to COVID as well as just, living one's life that people are dealing with every day, and people have different challenges and struggles across our city. And so there can be issues of understanding, there can be issues of stigma if one's seen in one's community to be going for testing. So basically, after our experience of testing in a number of communities and a number of settings, And considering the amount of resources it took away from the assessment centers to be able to do the testing, that we haven't been actively pursuing a testing strategy, but rather have been putting more emphasis into engagement with communities to better understand the situation and to try and work towards solutions that might include testing at some point in the future, but not to think that simply offering mobile testing will be the answer. If I could have the next slide, please. So in summary, I would say that the challenges with broad asymptomatic testing is the real potential for misunderstanding of the test results and being falsely reassured that it's okay to participate in higher risk events or higher risk social interactions, because in fact, as I explained, that test may be falsely negative, and in fact, you may be positive. And that the way to protect yourself is actually to be COVID-wise versus hoping to depend on a test. We have the downside of people may test positive but are not infectious. One of the scenarios is of course that they were infected sometime in the past, but they will have the downside of needing to be in isolation and their close contacts in isolation for 2 weeks, even though they're no longer infectious, because the test doesn't differentiate that. The real concern we have now with the lineups is that it may disincentivize people who really need to be tested, who have symptoms or who are close contacts and really need to get tested, but are discouraged by the lineups. And with school reopening and resurgence in cases, certainly the priority is to be testing the symptomatic individuals and high-risk contacts of cases. If I could have the next slide, please. So just in summary, I would say testing has its role. We depend on testing to identify for us who are the cases and to then be able to identify who needs to be tested. But really the most important thing we can all do, and we need to continue and actually increase our attention, is to encourage our members of the public to be COVID wise, to maintain distancing, to be wearing a mask, to not be going out if you're ill, and of course exercising proper hand hygiene. And so I'll turn it over to those speakers and look forward to your questions later.
Thank you, Dr. Malachny. Please note there are still 2 additional speakers, and then the floor will be open to questions and answers. Starting with councillors, I will call upon everyone who has registered, and then we'll go to MPPs and MPs, and we'll be going by alphabetical order. Alors, merci à encore 2 autres présenteurs. Quand c'est la session pour les questions et réponses, on va t'appeler par nom alphabétique. All right, please go ahead, Dr. Forster. Thank you.
Thank you very much, and good afternoon, everyone. I'd like to start by thanking the councillors, the MPPs and the MPPs and their staff who have joined us today, also the media and any public members who are joining. It gives me great pleasure to come to you and explain our testing strategy and how it fits into the discussion points that were brought up by Dr. Malachny earlier. And so I hope you find this informative, and I'm looking forward to the questions afterwards. It's important to understand why we do testing. The first important piece to understand is we do testing to rapidly identify disease, so that we may contain the epidemic and look after the people who have the illness. For the contextual purpose, I'd like to show you. This is showing the daily swabs that we've performed at our COVID assessment centers across the city of Ottawa since March of this year. As you know, in March, we had to start from scratch. We had no testing ability at all, and we grew quickly to 250 tests a day. It's important to note that at the time that we opened, we had lineups right from the start, and we've had lineups all throughout. What happens is whenever we expand our capacity, the demand grows to match it, and sometimes the demand grows before we get our capacity in place, and that's when you start to see those matches. I'd also like you to note 2 other things about this graph. One is that over time, we've increased our testing capacity in our city almost tenfold. So from that time when we were 250 a day and we thought that was hard, we've now almost got up to 2,500 tests a day. and we will quickly see that grow over the next few weeks. The final thing I'd like you to note is that where there is opportunity, you'll note that every weekend there's a decreased number of tests that are performed, and that does create an opportunity for us to increase the testing quite simply by just keeping the hours of operation open more. Next slide, please. I'd like to explain a little bit about what the challenges are in moving from the idea of testing people to making it happen. On the one hand, we have the capacity. The capacity really reflects the ability for our system to do the tests. It involves the people, the physical locations, the equipment, and all the logistics that are required. And over time, we've quickly enhanced that capacity. In our testing centers, we need to create a physical environment, and you heard Mayor Watson talk about finding the physical location. That, in fact, is a difficult step. The second piece is we have to find the people to do the tests. And we want to make sure when we hire people to do those tests that they're qualified, because they are doing medical acts that could potentially harm people. And so not only do we have to hire people who can be trained, but we have to train them to make sure they're up to speed. The third part is really at the testing site is really around the logistics and how we manage our processes. And we're continually working to optimize those. On the back end side, which is the laboratory, we've had to expand our testing equipment. The laboratory equipment is in short supply globally, but not only the testing equipment, but the materials and the samples, the materials that are used in the processing of each test are also in short supply. And so we're working very closely with our laboratory colleagues to ensure that we can get a good supply of that equipment and make sure that keeps up with the capacity components from the testing. Of course, the capacity is just one side of this. The demand is also in flux. And what we've seen over the last 6 months is that when the testing criteria change, when the public changes its behavior, we see large influxes of patients coming to the testing centers. And of course, it takes time for our operations to adapt to those rapid changes. It's quite easy to change criteria. It's very difficult to change the operations behind it. And so what we've been doing with our testing group has been working to keep up with those changes in testing criteria and also keep up with the changing behaviors of our community. Next slide. Here's the core components of our strategy, and it's, there is a lot of words on this slide, but hopefully the pictures can just tell the quick story. We do have 4 basic approaches at the core of our strategy. These are complemented by other approaches, but the main 4 in terms of massive volumes of testing on a day-to-day basis are illustrated by the pictures at the top. We have testing assessment centers. Really, that's where the bulk of the testing is happening. And these are very efficient ways to get people tested. We can have the staff for performing the testing are in one physical location. The logistics for getting the equipment in place are easy. And of course, it does help us manage flow. The drive-through model is a sort of offshoot of the assessment center model. And that's really where people are coming to a single location, but instead of going into a building to get tested, they're staying in their cars and we're processing people as they stay in their cars through their car window. The mobile testing center approach is, Brent just recently alluded to that. That is an approach where we take a mobile testing capability into a community or into a physical location, like a school, and we can set up shop so that people at that physical location can get tested. And the idea there is that we can set those up and move them around as required by the situation. And then the final approach is through what we call deployed assessments. And that's when we send healthcare professionals into people's homes or into into their congregate care settings. This was the basis of our response to the long-term care situation in the spring. And it has formed to continue to be an important part of our approach moving forward. All of these approaches have pros and cons. All of them are better suited in some circumstances than in others. All of these approaches have different cost implications, but the common factor is all of them are complex in the sense that they require logistics to be sorted out. All of them require back-end testing and have an important laboratory component to these. And finally, all of them involve people who are highly trained and highly sought after in our community for other tasks, including looking after patients in our hospitals and in our long-term care homes. Next slide. I wanted to share with you how we're moving this through at an approach. There are a lot of players involved, and to reflect that, we've established a governance framework to enable priorities to be set by executives and by the community, and for those to be translated into actions, and then furthermore for those people at the front line to feed up and provide information to the decision makers at the top. The Champlain COVID-19 Response Committee is a committee with all the healthcare leaders in our community, and is chaired by Cameron Love. But it also has hospital leaders, city leaders, as well as public health. Below that, we've established a COVID testing governance committee that's chaired by myself and Dr. Malani. Dr. Malani is representing public health and establishing priorities for testing and the approach, whereas the healthcare system representative myself is working with executing those through operations. We're working in close alliance with the Regional Testing Advisory Committee of Ontario Health East Region. As you know, Ontario has gone through a transformation in its healthcare system, and Ontario Health East Region now is the body that oversees our activities, and we work in close alliance with that team. The membership of our city's testing governance committee are all members of the Regional Testing Advisory Committee, and that ensures close alignment with the directions from the province. Below that, we have 3 working groups. We have a strategy working group, which is really looking at the new advances and addressing questions of policy. The operations working group is really executing on the plans and coming through with the information that's coming from the governance committee. And the testing information management working group is another critical component, which is actually something that most people aren't thinking about, which is how do we make sure that all of the information from each of these tests is flowing in the right directions and accurately. Next slide, please. I'd like to comment on some opportunities and next steps. Obviously, I mentioned, and the mayor also mentioned, the expansion of operating hours seems like the simplest way for us to expand our capacity immediately. On face value, that is absolutely true.
Excuse me, Dr. Forster, I'm sorry to interrupt, but would you be able to just unplug your microphone? It just doesn't seem to be working very well.
I'm not sure it's the microphone. Just a second, I'll do my best.
Okay, please proceed. Thank you.
Can you hear me now?
Yes, if you please proceed, that would be great.
Can you hear me?
Yes,
I can't
please
hear
go
you
ahead,
well.
Dr. Forster. Dr. Forster, we can come back to you if that's all right for your last slide. All right, I think we've lost Dr. Forster. We'll move on to Ms. Cloutier in the meantime. Please go ahead, Nini.
Can you hear me?
Yes, we can hear you, Nini.
Okay. So good afternoon, everyone. It is a pleasure to talk to you all today. I'm speaking on behalf of the Ottawa Health Team, Équipe Santé Ottawa. And as we are coming together as one team under the newly structured health system, we have been looking at ways of making services more accessible, making the system more accessible. And as we are looking at the pandemic response, we are looking closely at what the data is telling us. And as a result, we have developed a community strategy, or in the process of developing a community strategy. Next slide, please. The socio-demographic data is clearly showing us that certain communities that are at high risk, including racialized communities, have a higher burden of illness and high impact when contracting COVID-19. And what we're saying is that a different response is needed for these communities. When we look at the data in Toronto, 83% of COVID cases are in racialized communities. And in Ottawa as well, we are seeing a similar trend where very large numbers in the racialized communities are COVID infected. What are the reasons for this? This is these cracks in the systems that are being seen more now through the pandemic. The structural inequities, the structural challenges that have been present for a long time are now coming to light during pandemic. So what is the example of this? When someone who does not have the resources works in low income jobs, which is the case for the vast majority of racialized people, going to a fixed site can be challenging. If they have been tested positive and their test turns out to be positive, then the next step is isolation. So if you're working in low income jobs, it is very difficult for you to take care of your family. Even getting access to food becomes a big challenge. And a lot of the racialized people are also working in frontline jobs where they're more likely to get the virus. There are a lot of personal support workers who are from racialized communities. And also there are multi-generational families living in dwellings, and that can be in a single dwelling. So when you say to someone, self-isolate, that is very difficult. We need to build capacity for self-isolation and social distancing. It's not an equal approach doesn't work for everyone. So what we are saying is supporting the most vulnerable and most affected communities and reducing their COVID-19 incidence is an effective strategy. So rather than a broad testing approach, we are saying it is effective if we support the most vulnerable, and that it would be a strategy that would protect the most vulnerable, the entire Ottawa community. So soutenir les communautés les plus vulnérables et les plus touchées et réduire leur incidence du COVID-19 est une stratégie efficace pour soutenir et protéger l'ensemble de la communauté d'Ottawa. Next slide, please. So as the Ottawa Health Team, our vision is to improve access to quality healthcare for everyone and keep people well in their communities. So when we say everyone, it especially includes those who are the most likely to get infected because of systemic issues. And we are also well placed to leverage our relationships with health and social services in neighborhoods across the city to support communities in accessing quality healthcare where they live. L'équipe Santé Ottawa s'est engagée à améliorer l'accès à des soins de santé de qualité pour tous et à maintenir les gens en bonne santé dans leur communauté. Next slide, please. Next slide, please. So what we are proposing is a more holistic approach. So we are saying the intervention needs to happen more than testing. There needs to be more protection in place. There needs to be an approach where the social determinants of health, employment, transportation, access to food, access to social distancing, housing are all important. So we are saying there are three components to our strategy. One is a care pathway for primary care providers that includes accessing social determinants of health. And here we're looking at primary care providers as partners in health and take off the burden on assessment centers because there could be some front-end supports that could be provided. And then we are talking about a wraparound community support resources. So this is around tailored messages, so providing information that speaks to people's experiences. And we are also talking about getting other supports around. So not just the testing primary care providers, but we are talking about other, whether it might be a settlement worker, a community developer, a community resource person, a health navigator to help people access the other resources that are needed to keep them well in the community and to support them. And lastly, a strategic community priority testing team to respond to people who are disproportionately impacted by COVID-19. So that this means whether it is in their homes, families, communities, and there is work happening where we are working with the Ottawa Public Health towards this approach. Next slide, please. So during this, we feel community engagement is critical. It is critical that the communities that are living this reality are able to help us craft the testing and support strategy that will be well used and effective in communities that are most affected by COVID-19. Un engagement communautaire significatif est essentiel pour élaborer une stratégie de test et de soutien qui sera bien utilisée et efficace dans les communautés les plus touchées par le COVID-19. So to this end, we are working closely with the Ottawa Local Immigration Partnership, OLIP, and this is to engage community expertise, identify barriers, and leverage the relationships of community leaders and agencies. And OLIP has over the years been working very hard to look at what are some of the systemic barriers, what are ways that the communities, racialized immigrant and refugee communities can have access to resources. How can we improve our data collection so we know what the issues are and early on develop solutions to address the issues. But there is a lot more support needed. There are more resources needed to help the work on the ground for organizations that are doing this work. If there's looking at the race-based and social disaggregated data, there needs to be a lot more supports needed and investment needed in these resources. Next slide, please. So moving forward, we are in the process of operationalizing these first steps in the coming weeks. We are working with the community, with many partners. We have 70 plus partners in the city that we are working with, including Ottawa Public Health, and trying to align our efforts towards this. We are also recognizing that there needs to be work done with the flu vaccination process in the community as well. And we are looking at collaboration and coordination with other Ottawa health teams in our city and the primary care practitioners. And as we move forward, we will continue being data informed, and we will be working with the Ottawa Public Health to target the most affected communities and neighborhoods so that we can truly have impact. And as earlier on you heard, we have finite resources, so we need to find strategies that are most effective and most impactful. Next slide, please. So in the meantime, as partners in the Ottawa Health Team, and as Dr. Forrester had earlier talked about, the Ottawa Community Health Centers, as one of the partners, is continuing to support testing in congregate living settings across the city. We recognize that these sites are not all in outbreak, but we do recognize a heightened resident vulnerability, and we're supporting that process. We are also establishing a downtown fixed site testing clinic by appointment at one of our community health centers to support those in the core that don't have transportation cars to travel to the other clinics. I guess we'll have an opportunity for questions. Thank you very much. Merci beaucoup.
Thank you very much, Nate. Now we will try Dr. Forster again. Dr. Forster, are you there?
I'm here. I hope you can hear me now.
Yes, that's much better. Please go ahead.
I apologize to everyone for the inconvenience. Nini, that was very good. I hope, I'm glad to hear that. What we'll do is we'll move back into mine. I was talking about the expansion of operational hours at our testing centers, the ones that are existing and opened. I think that's obviously the easiest way to expand quickly. We still have the need for recruitment of staff and also the testing capacity in our labs to think about, and those are currently being put in place quickly. And as mentioned by the mayor, we're doing things about that today. There also is the expansion of assessment centers, care clinics. You heard from Ms. Cloutier the opportunity in the core. There also is looking at, again, the mayor mentioned the East End expansion and the identification of a facility. There are other options being considered related to potential centers in other parts of the city. And again, a mixture of the assessment center model versus the care clinic model, and the drive-through model. And finally, the mobile testing. You've heard Brent talk about some of our early experience. We're not ready to give up on that. We do think that there is still the opportunity in specific situations. And while we're hiring up for our assessment centers, we will have some. We will identify resources within those so that they can be moved quickly in the event that we need to move to a school or to a city, like a place in a community center quickly and emergently. As mentioned previously, there is a booking and scheduling system. We're looking at each individual center needs to do this because it's part of their own electronic medical record, and that's another issue that sort of the COVID pandemic is bringing to bear, how our disconnected electronic systems in healthcare, but one where we feel that at least at the Ottawa hospital centers and then in the other centers individually, they can come up with a booking approach. We would like to have a scheduling approach that would be across these, and that will be something we're going to look to in the future. I think it's also worth noting some of the innovative technologies that are on the horizon, some of which have been adopted in other jurisdictions and for which we're waiting for approval here in Canada. We do have a point of care device testing capability with the PCR test that Dr. Malotny talked about. There are a couple on the market, and we're looking at one in Ottawa that does need to go through approval from the regulator. Similarly, the saliva test, which was in the news recently, in which people don't need to go for a swab, a nasal swab, but they can provide a sample of their spit, and then the assessment is run on that material. That's a much easier approach and could potentially be sent to people's homes to provide the sample. And then the third would be an antigen test, which is a very different approach. It actually does look like a pregnancy test. So to Brent's point, the material does look like that, but it is something that's just come out and again has received emergency use approval in the United States. And it is something that we're working with Abbott to try and help facilitate and fast track a potential approval here in Canada. Next slide. I'd like to conclude just to talk about a global comparison. And I've selected a few countries here. I've selected these countries on purpose. You see Canada, New Zealand, Germany, and the United States. And you see their testing performance per capita since the beginning of the COVID pandemic. And you can see where Ottawa sits in relationship to these other benchmarks. And you can see we're actually doing favorably with the exception of the United States. And the reason why I show these points is that it's not, I'd like to make the point, and I think it's been made earlier, that testing is not going to see us through this alone. This crisis requires a much broader action and a much broader approach to solving the problem than simply looking at the number of tests we can do per day. And I think Brent brought that up, and Nady just also emphasized that really we need to look at the COVID-wise activities, and also look at society from a societal perspective, how we're helping the most vulnerable people in our society to ensure that they have access to the support they need. And the support goes way beyond the testing. The second thing I'd like to also show is that Canada, and Ottawa in particular, has the capacity to do this. If we look at New Zealand and Germany, they have done an amazing job controlling the disease in their country. Canada is doing a very good job in controlling the disease in its country. And it's because of many of the things we've put in place, including testing. That being said, our testing we do need to address the short-term challenges created by the reopening of the schools. And we need to shift our capacity and our use of capacity accordingly. And in order to do that, we need the public's support. We need to help get the messages out there as to what the appropriate ways to use the capacity that we do have. And then combining that with other measures, such as the WISE approach, and more importantly, in the setting of a positive test, how we trace and identify people who are contacts and help them understand their role in preventing the spread of disease. I'd like to conclude with just a final comment, just again to thank everyone, my co-presenters. We were working together on this. We are working as a region, and I do thank the people who are here today and who are listening and participating, because as I said, working together on this will make the difference. And I see that this type of forum and this type of platform is the way for that collaboration to occur. Thank you very much.
Thank you so much, Dr. Forster. So I will now invite each city councillor or office who registered to ask their question. We'll be going through the list alphabetically. You'll have one question and one follow-up for the first round. Nous allons maintenant prendre des questions des membres du conseil en ordre alphabétique. Chacun pourra poser une question et une question de suivi. So we will start with Councillor Rockington, followed by Councillor Cloutier. Please go ahead, Councillor Rockington.
Is it my turn?
Yes, please go ahead, sir.
I was just being reloaded. Thank you. I have more than one question, but I will respect the rules. Just some context. At City Council, at our last meeting, multiple councillors, whether they were rural, suburban, or urban, talked about the need to have testing centers in our communities, that there's a huge challenge with people not being able to get to the testing centers, or there are people who may be close to a testing center, but they have mobility issues or that. So I was a little confused with the first 40 minutes of your presentation, because the ask is about a testing center expansion in our city. So here's my question. How are the locations of your testing centers determined? And how can we get testing centers in our communities, rural areas, suburban, urban, whether it be in community centers, our health centers, our high schools? That's the ask. What is the plan?
I'm assuming that's directed to me, Mr. Brockington. We're working closely with the hospital leaders and the community leaders to identify options. There are existing testing centers in some of the rural areas. There are testing centers throughout the region. Clearly, there needs to be more. There is an idea of identifying the physical location as well as the staffing. And I hope that you can help us do that, at least with the physical location. The challenges with schools and many buildings is that they've got other uses, so we can't turn them into testing centers. And so again, we would be looking to the health leaders in those regions to work closely with folks like yourself to translate the need into some kind of response.
I'm going to move to my library meeting, which I've left to attend your session. I just say, we have lots of feedback to give you. We need a venue to give you that feedback.
Excellent.
Thank you, Councillor. We'll now move on to Councillor Cloutier, please. Oh, Councillor Cloutier sent in A question: what are the testing requirements expectations for private healthcare employees who provide healthcare services to individuals in private homes, clinics, group homes, long-term care homes, and retirement homes? Over the last few months, they've been testing for peace of mind because their employer is not taking responsibility for screening. Are either of you able to comment on that?
Healthcare workers face, specific risks because of the exposure to patients. In addition, patients could get infected from healthcare workers. So there is a special case for healthcare workers. We treat healthcare worker testing in the same way that we treat testing for people in the public in terms of the recommendations regarding symptomatic, versus asymptomatic. That being said, because of their situation where they may be exposed, there may be settings in an outbreak situation where we would test them in an asymptomatic fashion. In terms of getting the test done, we are working right now. The process is they're getting tested through the testing centers, the same way that a public member would, and we will. And for the time being, that's our approach.
Thank you very much for that answer. And yes, I had typed it in, so thank you to our moderator for providing that question. I have a second question, if I'm allowed, not really a follow-up. From your last slide, Mr. Forster, am I to note that there have been 240,000 tests in Ottawa at approximately 1 million person population, so 24% of the population has been tested, understanding that some people may have been tested twice or more?
Yeah, there's probably more tests than the 240,000 that I've listed, because there's also, that's the Eastern Ontario Regional Lab Authority data. There's probably about another 50 to 70,000 tests being done through private labs. So it is in that range of folks, but as you mentioned, some people are going for tests more than once. We see that in particular when we're trying, like early on in the pandemic, when we were clearing people after their initial exposure symptoms. So we were doing multiple tests to clear it out.
So I guess the takeaway, and I recognize I don't have any more questions, but takeaway is that testing is not the path forward to beating the virus. It is less risky behavior. It is being COVID wise, as you've said. And so I think that's the important message. Testing needs to be used, but testing needs to be used in a diligent manner. Thank you all.
Thank you, Mr. Cloutier. Yeah, we have the capacity. It's how we use the capacity. I agree.
Great, thank you. Councillor Dean's office has registered. Councillor Dean, are there any questions? All right, we'll move on. Up next, we have Councillor Dudas. All right, we will then go to Chair Aguilar.
Oh, I'm on the panel. I get to ask questions here. That's great. I do have two questions for Dr. Forster. The first is, early on, Dr. Forster, there was a local product, a mobile testing booth put together by the Honey Group that was piloted at a couple of different locations and seemed to be well received. And that also seems to have kind of dropped off the map. It's a portable one. It cuts down on the use of PPE, as I understand it. What's the status of using that sort of an approach?
We're keen, and we're continuing to have conversations with the Honey Group. They have recently provided me with a proposed arrangement so that we could work on it. I do agree with you with your comments about its pluses in terms of reducing personal protective equipment use and still protecting.
That a lot of the testing being done is being done on asymptomatic individuals, while there are children and families and healthcare workers that either are showing symptoms or have been referred by a medical professional. Is CRIC looking at any kind of a way that will triage people when they show up at the testing centers so that they, rather than making people wait for longer periods of time, or have people ahead in the line that you know, as I say, are not showing any symptoms at all versus a young child that may be showing symptoms or has been exposed to somebody showing symptoms? Do we have a way, or is just CRIC looking at a way to triage and maybe say to someone, you know what, we're going to take these 3 people first because they've been referred by a doctor or they have symptoms, and unfortunately, because you're not, you're going to have to go to the back of the line, so to speak? Or are we looking at that to make better use of the resources that we do have?
Yeah, we are, and we have. The issue is that there are different messages coming out across the system as to who should get tested and what are the rights of people to have tests done. I think, you know, this is a very complex issue. There's a perception that, as I said earlier, testing will get us through this, and that is the way to do it. There has been discussions also, and you know, the story in the CBC last week was of a person who was trying to get peace of mind before going to a social event. And I thought that kind of symbolized a situation where we're perhaps not using the test in the way it should be used. So there is a imbalance, and you know, managing these perceptions across at the time when they show up can be quite difficult, actually. I think it needs more than just doing the triage at the site. It requires the you know, public health to be aligned with the community leaders as to what is the right way to do this. I think you know, Ms. Cloutier mentioned very much about the need for community engagement, and this is about working at that level, so people understand the purpose of the test and when it won't work, as much as it is about what happens in the lineup when people show up. Because if someone comes and they've been waiting and they see this, it isn't always the best scenario for managing that kind of situation.
Okay, thank you.
Can you speak to that as well, our moderator?
Yes, please go ahead.
No, I just wanted to, I guess Dr. Forrester talked about that. I think that is what I was also talking to in the strategy that the Ottawa Health Team is undertaking, where we are looking at how can we have the biggest result for the investment of resources. And that is where we were saying that the vast majority, there's a high risk population, and we are looking at how can we work better so that it's not just long lineups at the testing site, but how could there be prevention as well as supports to the population that is showing the highest COVID results. So we are talking about the community-based strategy, which I was alluding to earlier.
Wonderful, thank you. So we will go back to Councillor Dudas. Please go ahead.
Thank you very much. So I was, first of all, I want to start by saying thank you to OPH, all our hospital partners, and all the essential workers and community outreach on this call. We're doing something we've never lived through before, and you're at the forefront. So I want to thank you for that. But I also want to say that I'm very pleased to hear that we're expecting an announcement about the East End testing center, and potentially one in the center of our city, as well as other locations. I wanted to inquire as to the status of the East End Center, but I also wanted to find out if these additional assessment centers are going to include testing for children. We've seen a number of children that have required it, and not all of them provide services for those under the age of 14. And I wondered if that was something that was going to be included in these additional sites.
Yeah, we've been looking, so just in terms of the, I think there's 2 questions there. One was about the East End. We're working as hard as we can, and in fact, that's being led by so the work they're trying to do that through the L'Hôpital Montfort, and Bernard Leduc, the CEO, is working closely there with others to find a location, and I believe they're close to finding that, and there will be an announcement soon. The second part was around the children. And we recognized, you know, we've recognized for about the last month and a half that we're going to have to do this based on the experience in other countries, and we've been doing our bit to try and figure that out. Clearly, there's more to this. We need to, and what, you know, from the children and youth health perspective, There is the piece of the expertise for swabbing the little kids. The older kids are a little bit, obviously more similar to adults, so they can be tested with the same folks. We're working closely with our colleagues at CHIO. They are very much a part of this. They're helping us. They're in Coventry. They're helping us they're in our Brewer Center. They're helping us try and look at Coventry, and then they're looking every time we work in a center. They're putting their lens on it to say, do we have the right capacity and the right skill set?
And my second question was winter. We can't have long lineups outside of assessment centers, regardless of where they're located. What is the plan for winter, and are these testing sites?
Right. So the booking piece that we talked about is hopefully going to remove the need for lineups. People can show up. The second thing is we're looking at some locations where we might be able to put the whole operations inside. And so those are the two things that we're looking at. Thank you.
Wonderful. Up next, we have Councillor Fleury. Please go ahead, Councillor Fleury. Not hearing anything from Councillor Fleury. We'll go to Councillor Harder. Please go ahead, Councillor Harder.
Thank you very much. And I'm mindful, I thought you said one question, so I'm going to just ask you one question. The big change with the numbers going up, but the really big change is all of our schools are back in. And those are the calls that I'm getting. I appreciate the thoughts of the remote unit that would be looking at going into specific situations. I think that would be great. But I have a question. We have large areas, like, for example, I represent about 70,000 people. The Fallowfield Park and Ride, which holds 2,000 plus cars, had less than 70 vehicles in it today. Strandherd Park and Ride, which holds 250 to 300, had 14. I went and counted. These are opportunities I think we have. I'm wondering if you've asked the military to come into the three, or the Premier has, to ask the military to come into the 3 areas where we're seeing the spikes that are the greatest with their tents, so we don't have to worry about the weather, and whether that would be a possibility to clear the queue so we could put larger numbers behind us. That's my question. Thank you.
Thanks, Ken. To your point about the school, I maybe Brent could comment on that. I'll just say that I don't think we've actually seen an impact of the schools opening yet. Like, we've seen the impact on our testing centers for sure, but in terms of the number of cases that we're seeing, I'm not sure we're actually seeing that yet. So I think we just need to watch for that. In terms of the ideas that you mentioned, those are fantastic ideas. One of the challenges we have is just the infrastructure that's present. So, like, for example, the power, the water supply. And so we are looking for centers that, like, areas where we can quickly connect to the power grid, as well as plumbing, and for cleaning and things like that. So those are some limitations. That being said, reaching out to the military may be something worth considering if we can set up those spaces. They may have some ways of dealing with that. If they can set up, in very remote areas, I'm sure they could help us with at an OC Transpo site. So thanks for those ideas. We'll follow up.
Yeah, no, thanks, Alan. Just to add a couple things with respect to schools. So, I mean, the schools are sort of phasing open, so we don't yet have all of the schools out. The cases that we're seeing so far really represent infections that have occurred in their community, and they're being picked up, but through screening or other means that as they come in, we haven't had any transmission in schools yet, which is a good thing. But with close to 160,000 children in school in the Ottawa area in the 4 boards, and close to 20,000 staff, all of those individuals screening every day for symptoms will generate a number of people for testing that would not have otherwise. I mean, we certainly had cases in school-age children through the summer. So knowing that, I mean, it's not unexpected that we'll have cases once school starts, but certainly screening for symptoms, which is very important to do, because one of the key things is keep it from coming into the school, will generate a need for testing. The other thing we're seeing is that because many of our cases, especially our earlier cases, were on school buses, we had cohorts of children, not only in the classroom, who we considered high-risk contacts that needed to self-isolate and recommend for testing, but also school buses as well. So instead of 3 or 4 close contacts per person, which was our normal coming up, with the early school cases, it's getting closer to 50. So again, that's increasing demand for testing as well.
Wonderful, thank you. Up next, we have Councillor Kavanagh. Please go ahead, Councillor Kavanagh. Oh, Councillor, I believe you're on mute.
Thank you. I didn't know if I controlled it or you did. Thank you very much. I wrote down a question, and it was to do with targeted areas. I think myself and Councillor Clucci are some of the highest areas, and it's to do with likely to do with vulnerable populations who cannot go to the drive-throughs, and we want to bring it to them. So I'd like to see more mobile, and I think it could be very targeted. I really appreciate the input of Ms. Cloutier in terms of just getting more information as well, not just about testing, but also working through to make sure people really understand the vulnerability of that they're in, so that especially with school starting, I think education is still important in those communities. So I'd like to know what we can do in that respect. Thank you.
So maybe this is one where the three have to work really closely. And the three I'm talking about is you as a community leader, the Ottawa Public Health and the leadership that they provide, and then finally the health sector. And I think this is where we're learning how to do that. As you know, there's structural issues with the relationship between these three groups, and I'm hoping that through sessions like today, we can come forward with a proposed approach where we can be more nimble. I've told you that we do have the capacity to move things around. It is limited. When we set up a mobile testing center at this time, it pulls staff from our assessment centers. So there is a willingness and a desire. It's sometimes a little bit about how do we make it happen, but having these conversations where you're articulating a very strong need and purpose, and we're coming up with a solution to work, I think is the most sort of productive way. I would add that Miss Cloutier and Nina Cloutier and team, where they're based in the community, those partnerships with that kind of provider group is a very effective team to help support the interaction. Coming in with the testing equipment can become a bit daunting, even if it is in the community. And so to be linked to community leaders, whether they be the healthcare leaders from that that community or otherwise, I think it does make a big difference.
And the comments about winter, I mean, you can make it pop up, not necessarily like a mobile unit, like at a place like Ron Kolpa Center in Lakeside, in Britannia Park, places like that throughout the city. So it's a little more nicer for the winter, as has been pointed out, but there's definitely some work to be done. Thank you.
Thank you so much.
I just wanted to also add that as we speak, the Ottawa Public Health with the OLIP table and the Ottawa Health team is looking at data around which neighborhoods this is spiking in and which communities. And we are working with community connectors who are going to be developing strategies with us in terms of reaching out to these communities. And that is what we're on the path to doing that in the next few weeks.
And I know you know the community, Nanny, since you've worked around here. So, thank you very much.
Wonderful. Up next, we have Councillor King, please.
Councillor Kavanagh really stole a little bit of my terms of the questions that I was going to ask around mobile testing. I mean, I was very gratified after a lot of advocacy work with elected officials in the Ottawa-Vanier region, Ottawa-Vanier federal riding, all of us coming together and really asking for testing, seeing that there was drive-through testing, at least at the Coventry site. But obviously, one of the major concerns is also accessibility to mobile testing in adjacent neighborhoods that have a prevalence of lower income residents. So that's something that we've been asking for. Also access for people with vis-a-vis active transportation. So I'm hearing from my residents in my ward who have to travel to Brewer. It takes them an hour and a half, by bus, and they have to stand in line for long periods of time for that testing. It seems difficult, extremely more difficult for people who have challenges around income, and it is very important that we service vulnerable communities. It's just very good to hear that, and I guess this is just a general comment, it's good to hear that there's now this coordination of data and looking at where these mobile sites would be cited. But I think it would be great if we could have some reassurance that this is the way that we're moving. And I guess the other kind of question I'll ask is in terms of enhancing testing. I know that this might be outside of the purview of the officials on this call, but I had also mentioned the approach of widening the different testing venues. I don't know if the hospital is also having conversations with the province around extending the mechanisms or the places of testing to include pharmacies, because those are obviously very accessible in our communities.
Maybe there was a lot packed in there, Ralston. Sorry, I apologize if I don't get it all, but maybe just on the bit about pharmacies and other options, I agree. We need to be innovative and try new models. We can't be stuck in a single way. We put forward those 4 models early on in terms of the assessment centers, the drive-through, the mobile, and the deployed. We have been using the deployed in some of the most vulnerable populations, but there is that kind of middle ground where there are folks who are, there are challenges still, and I would agree. So we do have to keep experimenting. And one of the things that I would say is that on the pharmacy front, that's being used in other jurisdictions. Where we see a big issue in terms of moving this forward is, if you have a small facility, and how do you balance off the infection prevention control risks with, so when folks are coming through, you have to make sure that people aren't getting exposed themselves, like the testers, and also the other people who are coming. Like if there's a low risk of illness, let's say it's like 2 to 5% in the group that's getting tested, and that's actually quite high, that means 95% of the people there don't have it. So if there's a small location, like a pharmacy, and there are other customers there also doing other things at the pharmacy, how do you make sure you kind of create a pathway so you don't cause sort of cross fertilization or cross infection? And that's, in working through these through these logistics, it's not always the easiest, especially when there are different corporate interests and different sort of models for reimbursement and things like that. So
Ralston, if I can just add, though, as recently as today, the Premier has said that that's something that the province is interested in, and that they are having discussions with some of the larger chains in terms of what could be achieved. So it's on the table. As Alan said, it's not without complications, but it's definitely under active consideration at the provincial level.
That's good to know. And I was just also curious about the commitments towards mobile testing in neighborhoods with higher prevalence. Is that something that we will see soon? Your latest update would be great.
Yeah, I'd like to do more of that. In fact, we've been talking about doing that in the next few days, actually. So we'll, it's just a matter of making sure we have the resources. As I said, when we pull when we create an open, like a mobile site at the moment, that means we're shutting down some opportunities in the assessment centers. And so we're balancing off the lineups in the assessment centers with the lack of availability in these other communities. And, you know, I think part of the thing is, yes, we want to do that. How do we engage the community to say, okay, what's the right balance here? And again, just that overarching message that testing, we're not going to test our way out of here. It is the behaviors, the wise behaviors that are the ones that we need to keep re-emphasizing and making sure people feel comfortable no matter what. And I recognize that even in some communities that may be more difficult for many reasons than others.
And I just wanted to also highlight that just taking a mobile van in a community in itself might not be the answer. And that's where we need the community-based approach, which is when people come to get assessed, it's not just whether they're COVID positive, what happens subsequently, you know, how do we put the supports in place? So it's just not just a matter of testing, but it's also having the right supports around the people so that we can support them. As I talked about, for some people, food might be an issue. It might be an issue of employment. So it's one thing to say, just isolate yourself, but you do not have the capacity to social distance, then what? So it's just it needs to be a comprehensive approach, and also outreach into the community for people to feel that they truly will be able to get help and be able to receive the supports that they need.
And I'll just reply very briefly that the July 11th mobile testing that really catered to Vanier Overbrook residents was an excellent example of multiple service providers kind of coming together and being able to provide other services in conjunction with the testing. So, you know, for lower income neighborhoods, we would love to see more of that.
Thank you. We'll do our best, Ralston, and we'll work together on that.
Great, thank you. Just in the interest of time, I'd ask that we keep questions and responses as short as possible to make sure everyone can go. We have Leeper. Councillor Leeper, please go ahead.
Thanks. Nani, a number of us were cheered to hear that the CHCs are potentially going to be looking at some fixed sites. What are the steps that you still need to accomplish in order to open up a CHC or several CHCs as testing sites?
So we actually are already looking at having a CHC site in the downtown core at Sandy Hill. And we are looking at people in vulnerable communities and those who are part of the CHC. Obviously, it's limited in its capacity. And also CHCs themselves are going and doing congregate testings where we can with our resources, and also going to, for example, rooming houses and shelters and other locations where possible, because we are serving vulnerable communities as well who are coming to our centers, and we have very limited resources. You know, in total we have probably something like 20 physicians, and but we have a vast reach in our community. But I think our approach in terms of a community-based response, which is through the Ottawa Health Team, is going to be broader. It's not just going to be looking at just the CHCs, but all the partners that we have around the table, and looking at how can we work with Ottawa Public Health, OLIP, Ottawa Local Immigration Partnerships, settlement agencies, and how can we together develop a community-based approach.
But sorry, Nani, what steps do you still have to undertake in order to be able to open a site?
So the steps in terms of, I think this opening of site at Sandy Hill is imminent. But the approaches that we are talking about, the other is not opening sites up. It's a community-based approach, and we will be working with Dr. Forrester, Ottawa Public Health, who are part of our Ottawa Health Team, by the way, is that we'll all be developing this approach all together.
Thanks, everyone.
Yeah, no, if I could just add something from OPH perspective, and I totally agree what you've just said, that in terms of, the testing in higher needs neighborhoods, it's more than just providing the testing, because actually you want the people at greatest risk of infection within those communities, because even though they're at higher risk, it's not homogeneous. Is you want the individuals and families at the highest risk within those neighborhoods to want to come forth for testing. And so that's why the wraparound services that the Ottawa Health team are describing are so important to be able to achieve that.
Wonderful, thank you. Up next, we have Councillor Lula. Please go ahead, Councillor Lula.
Thank you very much. I see that our LSQ interpreter is looking pretty bored. Alors, merci pour votre collaboration pour l'établissement d'un site de dépistage ici à Orléans. J'attends avec impatience l'annonce dont parlait le maire aujourd'hui et que nous avons travaillé très fort pour l'obtenir. What are we doing to support our local businesses that need to close while they await contact tracing by OPH following a positive case? I'm hearing that it's taking upward of 5 days, which means that these struggling businesses really need to stay closed for much longer than is acceptable. So just wondering what we're doing on that capacity-wise. Thanks.
I'm not sure this panel can answer that question. They can talk to you about the contact tracing and what's involved in it. In terms of supports, though, I'm not sure that's within the bailiwick of this panel, but I'll let Alan give it a kick at the can if he'd like to.
Yeah, I can't speak specifically to the support for the proprietor of the company or the staff at the company, but more it's about how do we facilitate their fast testing. I think that's what you're asking, right, Matt?
Exactly.
Yeah. So I think, ultimately, this is why we're here today, to talk about how we can manage the capacity and the demand mismatch that we currently have, making sure that folks, making sure that folks who are going for the tests are the right people, making sure that we're supplying the capacity where it's needed. And if there are folks who don't need tests but are going, we need to make sure that there's a way to help those people understand what they need to do instead of going for a test. And ultimately, if we open up, as I said, if we decrease some of that demand, which perhaps is not necessary, then that does create capacity in the system for faster turnaround for tests, faster service at the center, a lack of a lineup at the center, and I would say that's really where I would like to see a lot of the effort going.
Wonderful, thank you. In the interest of time, we'll keep moving. Up next is Councillor Meehan. Please go ahead, Councillor Meehan. We'll come back to Councillor Meehan. Up next, Councillor Menard. Wonderful.
Hi, sorry about that. Got to see if she'll go down. Thank you very much for your presentation and the information. Councillor Eglai as well, and your leadership in this. I wanted to come back to testing. We're all talking about that, and I think obviously it's one part of the the battle against COVID-19. But the reason I think it's so important to families is that they're wanting to get tested so they don't have to self-isolate for 14 days, right? That they can get back their kids into school or go back to work. And so even though it's just one piece of the puzzle in terms of solving, getting to a conclusion on COVID-19, it is extremely important for families. And so on our website, our self-assessment tool says, if your child has a runny nose, even if that's the only symptom, you haven't traveled anywhere, you haven't gone out of the country, you just have a runny nose, the current direction is go get tested. Are we still there? Is that still our message to the public in terms of that self-assessment tool? And I'll have a follow-up.
Sure, I'll thank you, Councillor. I'll take that question on first. So yes, that is still our advice. The reality is that children, on average, have milder symptoms. Certainly, even in adults, adults often will start with one symptom, a runny nose or a sore throat or a headache, and then may develop other symptoms. And as I said, symptoms are milder in children. So there's unfortunately no way to know whether that runny nose is a cold of a typical year or COVID, and we need to do all we can to keep COVID out of our daycares and our schools. As you know, we are experiencing a resurgence. We've got to keep as much illness out of the schools as possible, and so at the moment, yes, that is the guidance. Now, in terms of rapid testing, that goes back to having the testing capacity to be able to do this as quickly as possible and get the results back and the reassurance back for what will be the majority of families where it won't be COVID, but we want to not miss the ones that are.
Okay, thanks for that. And as you'll know, Brewer Assessment Centers in my ward, and staff have been working very, very closely with me on mitigating issues for neighbors, but also just helping with issues of lineups. And so we've got some good progress there. One thing that remains though is if we're going to an online booking there, and there's other folks in the core that still struggle actually to get to Brewer, is ensuring that we have both a walk-up center, bike-up center, roll-up center that doesn't require a car. And I'm hearing we're also going to be looking at a drive-through testing center that people can't walk up to within the core. Is that correct? Are we looking at both that kind of community health center model and another drive-through spot? Can you just confirm that?
That's correct, Sean. That's correct.
Okay, I guess I would just urge that we've got enough capacity in that health center for the walk-up, bike-up, roll-up crowd that struggle, may not have a car at all, but there's enough capacity there for that demand that exists within other councillors' wards in the core. So I just leave it there, and I just appreciate all the work that's been put in, and especially the frontline workers at the assessment center. They've been fantastic. Thank you.
All right, up next we have Councillor Tierney. Please go ahead, Councillor. Oh, it looks like
great. Hi, sorry about that, guys. First of all, a little bit of irony with the last name Tierney. I'm last in the deck of councillors, but yet my ward, Beacon Hill Searville, is ranked #1 for multiple weeks. Just by way of backgrounder for the other levels of government that are on here, I do want to thank all of them for getting together on this. I've worked very closely with my Ottawa Vanier as well as Ottawa Orleans people to see some possible changes to better identify areas. And through an inquiry at council, I did ask about Peel and Hamilton and others that do smaller zones, and lo and behold, I had a great conversation with Dr. Vera Etches, and it looks like we're moving to the Ottawa Neighborhood Study version. Instead of 23 wards, they'll be better defined at 103 so we can see the pockets, because I do actually have the highest Syrian concentration in the city of Ottawa in Donald Street. They're in a very small, confined area. Councillor King alluded to the fact that we had some testing out there, which is good news. I think out of all three great speakers today, a lot of the comments and discussions from Madame Cloutier, I tie closely to. So I guess my question is, are we still on track in the next couple of weeks for the Ottawa Neighborhood Study, 103 zones, so we can better identify and help the people that really need the help? Is that still on track? And as well, originally it was in discussions about it could be on a monthly basis. Frankly, I'm hoping it's more like weekly, or I'd really love daily, to be able to have those areas specifically where the hotspots are so we can help those people out.
I think this is a better question for Brent. I don't, given that it was a study that Vera mentioned, I'm not really sure.
Yeah, no, Councillor, I can get back to you in terms of the exact timelines. I don't know exactly when it's going to be out. I can say though that, in terms of having enough numbers, I think one would need to have sufficient time periods in between reporting. I don't think daily reporting is going to be able to be that helpful to you. But I can say that members of the teams here at OPH have been working with the Ottawa Health team to be providing data and to be in discussions around where and what can be done in terms of engagement, because that as I said, our early experience with just testing wasn't that successful in terms of generating positives that we would have anticipated. So that engagement piece, that the multiple partners working together will be really, really important to work with these communities.
And thank you for that. And I've seen some of the sample stuff. Dr. Etches gave her very valuable time to expose some of what it could look like. I think it will be extremely helpful to have those maps so we can really help the people that really need that help. And on my follow-up, when it comes to the COVID tracking app, have we actually, how many pings or how many have been identified through that COVID app here in the city of Ottawa? Do we have that kind of data?
I don't have that data here with me today, but again, that's something I can check and get back to you on.
Wonderful. Thank you very much for everything.
Great, thank you. And thank you very much to our other elected officials who stayed on this long. It's a very long briefing, but we appreciate the time. I'm just wondering if Minister McKenna, MP McGuinty, or MPP Lalonde, MP Lalonde, je m'excuse, would like to go ahead with a question. Madame Lalonde?
Oui, merci beaucoup. First, I want to say merci beaucoup. I know I had to step out for a while, but I wanted to say thank you to all the great work that our city is doing, and certainly with all level of government working together on this. A few things that I was just curious to know, and maybe I know that as a first part of the conversation, we've talked about the component of the laboratory supply and human resources. So I know we've been spending a lot of time, particularly about the testing, and certainly I work very closely with my local elected official to get something happening in the East End, and certainly we look forward to hear announcement possibly soon. But the reality is that as many tests as we do, people are waiting. And when you look at the province and overall backlog of the testing laboratory capacity in terms of releasing numbers to us, and I think Matt, Councillor Luloff alluded to the business component of over 5 days. Where are we at, and what's our plan, and what can we continue to do for you? And then the other question, since I have the floor, it's federal, we were very happy to come forward with the Safe Restart agreement with the province, and the province then was supposed to transfer funding to municipalities, hospitals, or OPH. I just wanted to know if you have received all the money from the province that was allocated on behalf of the federal government.
I'll first mention about the testing capacity, because you're absolutely right that we can take samples, but if we can't, if we're backed up in the lab, it's a waste of time for everybody. And there is a lot to be said for the work that's going on there, and there has been a lot of help from the federal government to support that, as well as provincial and others for that to help move that forward. That being said, there's a global shortage for those tests, the PCR tests that we use, as well, and more importantly than the machines, the actual reagents that we have at the background. So there is a fundamental challenge in the supply chain for that, and we're struggling with that more than probably, and I don't think there's much that can be done there. It would be something to talk about, I think, at your level. The second part where I think you could help would be, we have those testing technologies I mentioned at later on, the point of care testing, the saliva test, the antigen-based test that Abbott's just come forward with. We need it to accelerate the approval of those, even if we're using them in a pilot or in a prototype fashion. And I think maybe a different way of regulating these in this setting, where we can actually have their use, but under very specified circumstances where the population knows what's happening, how it's being used, and we're using it in the right way. So it's a more of a controlled application, as opposed to this, the more formal regulatory process that's going on. It seems to be taking too long for that. And other countries have moved those things forward. It may be worth there may be a caution process going on there, but it would be nice to sort of have a dialogue with people in the field. But those things could be game changers, and so we need to really think about how we would do that. So those would be my two pieces of advice.
Okay, anyone is able to say if all the money that was part of our agreement has been transferred to the from the province to our city?
Ryan, would you like to speak to that?
I'm just wondering if Chair Egley wants to respond to that.
You might have had to step away. I don't know the answer.
Okay, so I'll give it. I mean, I think that we're in discussions with the province about we've received our funding letter for this year, and we're in discussions with the extra effort that we've been putting in this year, and the types of funding that is going to be required.
Wonderful.
So politically, maybe the money has not yet flowed completely to you at this point.
We have projections for the year, and so we're having those conversations with the province.
Great, thank you very much. And again, merci à vous tous. Great work, I have to say.
Merci. Up next, we'll go to Minister McKenna. Thank you for your patience. Please go ahead.
All right, it's always good to follow Marie-France Lalonde. Alors, un grand merci à tout le monde. Certainly, I know everyone is working really, really hard, and that's incredibly important. And I want to give a shout out for the data that you're getting. That's really understanding how we prioritize the most vulnerable, and hearing numbers about the impact on racialized low-income workers, priority neighborhoods, I think is really important, so that we can understand that both at a local level, but I think at a federal level, and come up with unique solutions. So, I mean, I'm certainly here to help. I know all our federal colleagues, I'm sure all the politicians on the line are here to help in terms of getting the messages out around behavior. I think that's really important. It's good that I just retweeted something, because I think it's slightly confusing for folks understanding bubbles, and if you're inside versus outside, and who you can be beside, and whether you have a mask. So I think we need to keep on pushing that out. And I understand your messaging on testing, that you're saying, I believe, that not everyone needs to get tested if you're asymptomatic. But the reality is, I mean, parents are really worried about kids going back to school. I think we all want to see if there's a possibility that there's been exposure, that we get the testing done really, really quickly. So, I mean, I think it's a reality, and I know you've adapted, and thank you for that. Extending hours, looking at new centers, I think is really key. As much as we can try to get the message out, don't get tested if you don't need to. I think it's just important, if people are in line believing they need to get tested, that we actually get through those numbers. So I think it's really what can we do to help as a federal government? So I was in contact, as I'm sure my colleagues were, Marie-France and others, with Patty Hadji, the Minister of Health. We basically said, we'll do whatever it takes. The reality is we've already provided the province $2 billion for testing, tracing, and data. I also heard about the importance of community partners. We provided funding through the province, sometimes directly, to help vulnerable populations, partners that are serving them. We talked about social determinants, food, housing, etc. So I guess the question is, what more can the federal government do? And to Marie-France Lalonde's question, I think it is really important for us to understand, is the money flowing that we have allocated? Because we're willing to do more, but if there's still money that should be flowing, obviously we want to get that flowing as soon as possible for testing, tracing, data, and all the other things that we've been trying to support the city on. And I think it's just not entirely clear to us. So I maybe it would be great to hear if there's more we can do. Booking the money is different than actually getting the money. And we just need to know, do you have the support you need, and what more can we do? Because it's so critically important. I think you've seen our retreat was very focused on, got to get this right now. I don't know, is anyone there?
Sorry,
I lost everyone.
Yeah.
And I will say, I will say that I have just sent a text to the key ministers to find out about this global shortage for PCR tests and reagents, just trying to understand that piece. If there is an issue, we're on it. Anything you can tell us to help you, that is my key priority as a local member of parliament, also as part of our government.
Yeah, I think the data piece, I think the things you're doing are the right areas of focus for the federal government. You know, understanding how we're doing across the country is pretty critical, and having those ability to quickly learn. So we have a learning system. You know, we're talking about how we learn in Ottawa, but there might be other jurisdictions in Canada that have solved some of these problems. So how can we set up a framework where local communities can learn from local communities elsewhere in the country? You know, we go up through the province, and then you know, the comparisons to other jurisdictions may get lost. And I think that's a place where the federal government could support. And that is quite a difficult thing when we have very different healthcare systems across the country. But it is something worth working on, because we do want to make sure all Canadians have access to a similar level of support. I would argue that in terms of the flowing of money, you might have the wrong people here. You know, you know, I think we are working closely with our provincial, like the hospitals and healthcare organizations are working closely with our provincial counterparts. The funding doesn't come directly to us from the federal government. It would be going through the provincial government. So I think those questions need to go to those folks. We are being well supported by the province. We are having very good collaboration with our Ministry of Health, our Ontario Health team, infrastructure. And so I would argue that it looks promising. That being said, everyone's under pressure, right? There's a lot of different pressures on the system. And so you know, I think we just need to keep working together. As people have said, the multiple levels of government need to keep talking to each other.
So, I mean, I would just follow up. So, I mean, I think that obviously our key is what, like, if you're missing things, if you do not have things, if you're saying, like I've just said, that we need to clarify with you on reagents, that's actually not accurate. So I'm happy, I'm on it, whatever we need to do. So if you're hearing that that's the case, and that's actually not the case, we need to solve these problems in a very, very practical way. And if you don't have the support, like if you don't have the money you need to do things, we want to make sure that the support is there, because I totally agree. No one cares what level of government is responsible. They want to make sure that we're getting things done, and we've done what, you know, we keep on trying to respond. But if there's more we can do, and I don't even mean this as a political statement, I just mean if there's more we can do, please reach out, and we are there for you.
So as a community, I think we could get more engaged in some of these innovative testing approaches. I think that would be something which I would want to promote in our city, and a capability around that. I think it's great that we've pushed out.
I think that our minister, I think our minister will maybe follow up on the reagents, because if that's what's holding up getting test results, and maybe there's some issues or maybe not entirely accurate, I think we just need to just all hands on deck, because we know that we need to do preventative behavior, do testing, get the results fast, and then of course do the contact tracing. But anyway, I really do appreciate this. I think it's really important that we continue this, and always feel free to reach out to me or my office or any of my MP colleagues.
No, thank you, Alan. I think you gave a really, really good answer. The thing I would, in addition, to point out is, you know, depending on where things go in the upcoming weeks, like, you know, the crystal ball is always murky in terms of, you know, are we going to plateau, or are we going to continue to increase? So I think the last thing you mentioned was contact tracing. Well, as the numbers increase, so does the demands on contact tracing. I was pleased to see the federal government put out very recently, in the last couple of days, online training modules for training of contact tracers, because I think we're going to be looking at, you know, individuals with not necessarily a health background or have worked in this area, who will need to be utilized as the numbers increase. So that kind of a training availability will be important. I know the federal government in the past has made some of their own staff available. So, you know, probably further conversations about doing that, because as we see the large urban centers, experiencing these escalations in cases, all of them will be needing potential assistance or other sources of staffing to be able to assist with the contact tracing efforts. And as I mentioned earlier, especially with some of the school cases, the number of contacts are much greater than what we've seen in the past.
Wonderful.
That's very helpful.
I was wondering if I would just also mention, thank you, Catherine, for you're always there to support, so it's great to see you. I was also wondering about an infrastructure for the collection of race-based and socio-demographic data. That is really critical as we try to be data-driven and to find solutions that are going to be relevant to the communities. And right now, we are working with Ottawa Local Immigration Partnership. We are working with Ottawa Public Health. But we need data not just in health, because when we're looking at the social determinants of health, we also need to look at housing. We need to look at education. We need to have a comprehensive understanding if we are going to look at supporting these communities, because today it's a pandemic. Tomorrow there might be something else, and the cracks will just get wider and wider. So if we have a little bit of a long view, so we're not just looking at just the pandemic, but looking at what are some of the solutions in the long run. It's really important that we be data driven and we have a infrastructure which is solid, because right now we're just pulling from here and there from little streams of monies that are coming, but we are trying to develop an infrastructure. So any support that the federal government can.
That's great. And then I will say it is a top priority for us to get this data. So whatever we can do to help you to understand, in particular, it seems like it's huge numbers for racialized communities, for essential workers, in particular neighborhoods. And I think that's really key. It is key to keeping the numbers low and protecting people. So anyway, I've taken up far too much time, but Nini and others, I really care. And I am on the key ministers to just see if we can get some clarification on some of the things. But anyway, anyone can feel free to call me anytime or my office. And we're all in this together. And our role is to obviously keep residents Ottawa safe and healthy. So thanks for that. And I will continue to try to get your messages out.
Thank you, Minister. So that's all the time we